and the moderator of this panel, uh, Caritas Kailisa, to Maimuna Zertachelo,
Soledad Salvador, Alina Nikanen, Retaroli, and the moderator, Ana Valverde.
This session has to do with the opportunities and challenges of costing policies and the sectorial interventions. In this session, we're going to look into the sectorial policies. The panelists will discuss how to involve the sectorial partners and to consider the necessary links between the sectorial policies of the frameworks and the national policy. We have case studies of 4 sectors: agriculture, violence against women, employment, and HIV/AIDS. Amongst the panelists, we have Caritas Kailisa from Rwanda with the presentation of agriculture and gender, and we will also have amongst the panelists Risorcello from Albania, and we're going to have Soledad Salvador from CIEDUR from Uruguay with the presentation regarding costing and impact of differentiated permissions for maternity and paternity, and Retaroli from UNCIDA Argentina with costing of the commitments of HIV prevention and the fulfillment of human rights. This will be moderated by Ana Valverde, who is the coordinator in F4GE in Honduras. Thank you very much. I would like to come into session number 5. We're almost in Ecuador. We're halfway through the seminar, and I believe that it has been very interesting to see the differences, methodologies. As I commented with my colleague, what is this costing thing? What is this budget costing? What use does it have in relation to gender equality? And well, in this session, as our colleague commented, we're going to go from this previous session where we're seeing the costing of more macro plans or national plans for gender equality. In this session, we're going to have a little bit more specific at a sectorial level. And besides seeing the sectorial, we're also going to be able to see different methodologies that I'm sure that all of them are going to provide us with new opportunities for we see what it is that we can do in our countries, and we're also going to know the challenges. And since it's a little bit tight, we're going to give the word to the person from Caritas, Kailisa. I hope I said it well, from the Ministry of Agriculture from Rwanda.
I work in the Ministry of Agriculture and Animal Resources in Rwanda, and I'm coordinating the gender mainstreaming strategy in the same ministry. I thank you for this opportunity to come in Bolivia and share with you all what we've been able to achieve as Rwanda, and also to share with you some experience and best practices so that maybe you can learn from us and we may learn from you too. In my country, when you talk to somebody that you value, you have to stand up. Yeah, allow me to. Yeah, allow me to present to you the opportunities and challenges that we faced when elaborating our sector gender mainstreaming strategy in Rwanda. Actually, we working with which? Thank you. I was talking about what I'm going to share with you. Mainly, I wanted to share with you something related to our agriculture gender strategy and how it's coming out of the social political context of gender in Rwanda as a country. Then I will talk about our costing experience, the benefit that we got from it, and some challenges and way forward. I will also share with you some lessons learned and the recommendations. In Rwanda, we had a gender mainstreaming strategy which was approved and amended by all different stakeholders. It was in April 2011 in Kigali, Rwanda. And the main actors were mainly the Minister of Agriculture and Animal Resources, the Gender Monitoring Office as an institution, the Minister of Gender and Family Promotion, the UN Women, and the SIDA Swedish as a development partner. Talking about the gender context in Rwanda, most of you maybe know Rwanda as a country whereby the mostly worst thing known about Rwanda is the genocide of 1994. But after the 1994 genocide, Rwanda emerged and actually is at a level whereby development is a crucial cross-cutting issues in our sectors and every context that we are working in. I cannot talk about gender in our country without talking the political will that emerged after the 1994 genocide. We've had a leadership that is willing to promote gender equality as one of the pillars for sustainable development of our country. That political will actually influenced the constitution we had in 2003, and the same constitution clearly defines gender equality as a tool, as a milestone for our development as a nation. And it has some articles, specific ones, about gender promotion and women empowerment in particular. For instance, the Rwandan constitution says that in all decision-making positions, at least 30% must be women. And it says that on the top of all, women and children have to be catered for, and our rules and regulations and whichever intervention we are doing, we have to see first that women and children are catered for and their rights are well recognized and respected. We have a strategy known as the Vision 2020. That's where we want to be as a country in 2020. All the Vision 2020 and the strategy, the 5-year strategy known as EDPRS, the Economic Development and Poverty Reduction Strategy, be it phase 1 and phase 2, now we are in phase 2, all have emerged under the Vision 2020, and the national gender policy was there to regulate and to determine different, I may say, interventions from different sectors of the economy. And that gender policy actually inspired our gender mainstreaming strategy as the agriculture sector. The agriculture gender mainstreaming strategy was with an aim to make sure that all the agriculture interventions that we are conducting actually benefit equally men and women. We have what we call that is a French acronym, the PSTA1. It's a plan, it's like a plan of transforming agriculture. We are now in phase 3, and we realize that the 2 phases were not actually catering for women. And we have women, more than 80% of our women are working in agriculture sector. And having those plans, those strategic plans that do not really care or cater for the benefit of our women who are working tirelessly in this sector, we realize that it is something not good, and it cannot actually let us develop as we are planning. Then we elaborated an agriculture gender mainstreaming strategy. The gender mainstreaming strategy actually was across those 4 programs that I do not want to explain much here, but I will focus on the costing experience. The partners in agriculture sector having the gender component is in their intervention was grouped together in a what we call subsector working group. A subsector working group is made up of the agriculture ministry and all the stakeholders in the sector working group, mainly development partners, government institutions, civil society, and all the stakeholders of the sector. We have what we call national gender machineries, including the Ministry of Gender and Family Promotion and the Gender Monitoring Office. And those ones were also involved in the above mentioned subsector working group. We got together and started examining the existing strategies. Those I mentioned above related to the transformation of agriculture, related to the development of a country as a whole, and we started assessing each and every strategy and see if it benefits equally men and women. Then, based on the gaps that we were able to come up with, we designed related interventions. After designing related interventions, then we come up with a plan of action, which had to be costed. And here, it's worth to mention that actually we didn't cost all the activities related to gender here. No, it was something like a prerequisite, something that we thought it is prerequisite so that gender can be mainstreamed in the whole sector. And this comprises mainly of training, the capacity needs assessment, the studies, and the capacity building of staff, be it of the ministry or in the whole sector. And after that plan, then all partners get together and in the wider sector working group, what we call sector working group is made of all partners, development partners, the ministry and other government institutions related to agriculture. Then we wanted to know organizations that were actually interested in investing in that gender mainstreaming strategy. And the main one was UN Women, SIDA, and the government of Rwanda. Talking about the benefits, it's sincerely obvious. And here I should mention that costing the gender strategy alone cannot be the only tool to reach gender equality in each and every sector. No. Why? Because as we were implementing the gender mainstreaming strategy, we came up with a conclusion that actually what we need to do is to make sure that each and every strategy is gender responsive. And by mainstreaming gender into our 5-year strategy as agriculture sector, actually we realize that it is mandatory that every sector has to make sure that its strategy is gender responsive, rather than having a separate strategy saying that it is a gender mainstreaming strategy apart, but to make sure that every strategy is gender responsive. Yes. As for now, we have a strategy in agriculture sector which is gender responsive, and we have like agronomists and veterinarians in every sector who are trained about the gender responsive service delivery and all that. Yeah, there was some challenges, of course. Despite the political will that I was talking about, there is still some ignorance, and people don't take seriously the request that we are saying in each and every intervention. You have to make sure that this number of women, this number of men benefited from a given intervention. People still neglect that. And there is an understanding that gender mainstreaming is a task of one individual, the gender expert. For instance, in the Ministry of Agriculture, when there is an issue in regard with gender mainstreaming, everyone looks at me and think I'm the only one to be responsible. Whereas actually in each and every intervention, the responsible of a given department should be able to make sure that the intervention is benefiting equally to men and women. So as a way forward, we are planning to make sure that we engender the existing monitoring and evaluation tool so as to have gender disaggregated data at a regular basis. Also, to tackle this issue of concern and the responsibility, we thought by engendering our PSD targets, everyone now will be responsible to make sure that he or she defends what he do in terms of overcoming gender gaps in different interventions. So what we've learned therefore is that gender mainstreaming strategy are a very useful tool in line with prioritizing gender-related interventions in the sector. Also, gender-responsive targets in sector strategies are the only way towards the elimination of existing gender gaps, because you cannot eliminate what you don't know at what you haven't assessed. So every sector of the economy should say that it should have its own gender mainstreaming strategy, and to be able to engender the M&E tools, which is very crucial as far as I'm concerned, if you want to tackle the issues of gender gaps in each and every sector. Yeah, I may say thank you and maybe stop with here. Others may.
Since there's 4 people that are going to be presenting the methodology, it's better if they present them first, and then we make the questions later. Given that, we would give the space to Mr. Ritarcielo from Albania, who will give us a presentation regarding an exercise regarding costing from.
Well, the Albanian experience focused on costing all the measures to address the phenomenon of domestic violence. And in more concrete terms, we focused on costing the protection orders, as well as the community coordinated response to domestic violence, which is a mechanism established by law in order to address domestic violence phenomena in Albania. To give a little background how we came to this point, how we came with these costing exercises, we had a momentum in Albania since 2007 as the phenomenon was increasingly growing and increasingly being reported. We had the first ever initiative of civil society, law-making initiative by civil society, and this is the first ever law that was brought to the parliament by civil society, by 20,000 voters or citizens. And the law on measures against domestic violence in family relations was adopted in 2007. Since 2007, a lot of bylaws have actually followed this law, but also an amendment, a critical amendment in 2009, which also establish this community coordinated response, which is a mechanism that should be established at the local level in order to get together all actors, all key actors at the local level to address phenomenon of gender-based violence and domestic violence. As I said, there was high attention of society to the phenomenon, citizens. The phenomenon was high also in the agenda of the government, but also with the international partners working and carrying out development programs in Albania. Also, this costing exercise was a follow-up of the costing that was done at the same time in 2010 to the National Strategy on Gender Equality and Eradication of Domestic Violence. Well, the simple motivation was actually to counterfight the phenomenon, the gender-based violence, domestic violence phenomenon, and ensuring financing and financial resources for adequate services and adequate programs in addressing the domestic violence. Ideally, we opted to assess the cost, as I said, the cost of implication for all key actors in addressing domestic violence. And to mention here, their key actors in addressing domestic violence is central and local government, but as well state police, which is pretty much involved, district prosecution as well involved, judicial district courts, local government units, as I mentioned, healthcare services, education services, and social services. But as well, not to forget, also the survivors of domestic violence. Well, this methodology also opted to provide some costing models, some costing typologies for local government units so they can adopt it from one city to another city, from one municipality to another municipality, from one local government unit to another local government unit. As per the partnership, UN Women, in close cooperation with the Ministry of Labor, Social Affairs and Equal Opportunities, which is the responsible ministries in targeting or implementing national commitments toward gender equality and addressing domestic violence, also partnered with Center for Legal and Civic Initiatives, which was the center that led the lawmaking initiative back in 2007, and also had great experience in providing, fulfilling bylaws, and as well had extended experience with legal counseling in cases of domestic violence, and as well case monitoring in courts. Other key partners that we actually couldn't go with this costing exercise without involving them were state police, district courts, key partners, and as well the 4 local government units which we piloted this costing exercise. Basically, on the methodology, we kind of worked with 2 variables. We worked with work time and with money. So our methodology was designed to identify the means and the work time spent by all these actors involved, the actors that I mentioned, in addressing a case of domestic violence. Basically, we wanted to know what time they do spend in addressing domestic violence, how much that time that they spend costs, and in order to provide the responsible institution with a chart of time and the costs that they have to keep in mind when preparing their respective budgets, given also, let's say, a reporting of the phenomenon trend, so it will be easier for them to plan ahead and to have adequate staff, means, and financial means to address or to respond to the needs of addressing the domestic violence cases. A team of consultants was established, composed by lawyers, law practitioners, economists and accountants, gender and domestic violence experts. As well, we sought from UN Women also the international expertise in similar cases or with similar practices. And I have to say that it was a similar practice that we adopted to the Albanian context, but we inherited from the South Africa. 4 tailor-made questionnaires were developed for these key actors, basically given their respective role into addressing the phenomenon. We ran into a lot of information and data and tried to analyze them to come up with a good costing report. So basically we worked with time used by these actors. We followed continuously and we analyzed continuously all the steps that each actor by law has to follow in addressing a domestic violence case. And we measure the time and the cost for each of the steps that these actors follow. We also defined the types of domestic violence cases, and there was a difference in cost and money in addressing a simpler case compared to a complicated domestic violence case. So we calculated both of them, and we also came up with a rationale of the average simple case and the average complicated case per each of the municipalities, the pilot ones. Also, we were focused basically on the cases that were officially reported to the state institutions. Other information that we tried to work around, although we had difficulties and challenges, were the administrative cost and the services that were sought outside the CCR, this Community Coordinated Response System. So basically in all municipalities we have this coordinated community system. All state and non-state partners are aligned into one system, but also we have other service providers, basically non-for-profit service providers, which not necessarily are part of this system, so they also deal with cases, and we tried also to take into consideration that the information was provided by them. How to make this costing exercise linked with whatever is going on in Albania. I think that this costing exercise was very helpful for national government planning and budgeting. We know, although we had the costing exercise targeted at the local level, there is a responsibility of the central government, of the national government, also to provide grants and incentives from the central budget to the local budget for different services and different types of programs. So it well fits with the national planning and budgeting. But as well, it was good enough to highlight the importance of different key services, like for example, the legal counseling, which also builds on the efficiency of responding to the domestic violence. And we found out by the study that the more legal counseling is provided and in a timely manner and in a professional way, the less our cost in addressing the domestic violence phenomenon. Also, this study also builds on the formal cooperation between all these actors into this community coordinated response to domestic violence, being state or non-state institution actors. Also, the costing provided concrete budgetary requirements per each of the partners involved, or per each of the partners that we studied and we analyzed. So it would help them for budgeting purpose in the long run. We also estimated the cost of a single DV case, so domestic violence case, and this is something that is very helpful also in developing the national response towards domestic violence. This initiative also is in alignment with the implementation of the current strategy, the national strategy, intersectoral strategy on gender equality, gender-based violence, and domestic violence, and as well in compliance with the CEDAW concluding recommendation of 2010 for Albania. We think that this study is a good advocacy tool for planning and budgeting in the first place. For planning and budget with state institutions like state police, courts, prosecutors, so they can ensure sufficient and adequate human resources, personnel, and as well infrastructure to address the phenomenon. But also it's critical for national planning and budgeting, especially with the Ministry of Finance, the Ministry of Justice, and Ministry of Interiors. Although a lot of domestic violence cases are happening at the local level, but as well there are these ministries that are accountable to delivering their services, and also to anticipate budgetary lines in their own budget in order to satisfy these services at the local level. Immediate results, few results that we opted by this costing exercise was that certain institutions did realize of their personnel requirement, human resources requirement, and they have also appointed specific personnel to deal with domestic violence cases. Like, for example, in courts now, first instance courts, district courts in Albania, you randomly find judges that deal with family relation and domestic violence issues. So they're targeted judges. And also in state police, you have police officers that are mostly primary responses to the domestic violence cases. It came out also clearly that capacity building of this personnel, the response personnel in this institution had to be raised and had to be furthered in order to build on the efficiency of the phenomenon, and then also thus including the reduction in the costs that needed by these institutions to respond in the timely manner. Also, we saw that few budget lines were added, not to that extent that we anticipated or we dreamed of, but as well we saw that at least there was a step forward by state police, by the Ministry of Justice as well, by courts, because they added a little bit more budget in let's say satisfying more staff and more response towards the phenomenon. Well, definitely the challenges are manifold. I mean, it's not easy when you come up with a custom report and you get adopted right next day by the government. But besides the financial requirements that this costing exercise came up with, we also highlighted few challenges that needed to be addressed at the center and the local level. One of the challenges was the weak coordination between these customized actors at the local level to respond to the community response to domestic violence. We saw that in a few municipalities the system worked perfectly, so that there was a huge cooperation, information exchange and flow between all these key actors. But in some of the municipalities, we didn't find that this cooperation was to the benefit of the process. Also, we found that within this institution or within this actors group, a few institutions had adopted or had taken steps or measures to either increase their respective budgets or allocate human resources to the community coordinated response. But other institutions weren't really into that stage. So since it's a flowing process between all institutions, and each case had to go through different institutions in order to get well addressed. So we had backstops from different institutions, and we tried to come up with some recommendation for these institutions and lobby with these institutions in order to supply adequate staff and timely response to the case. Also, we found out data discrepancy between state figures, state data by state institution, and the NGOs or service providers by NGOs. And this, believe me, wasn't really easy to manage, but also we kind of had a backup opportunity. When we had the final drafts of the study, we also conducted the consultative processes in order, so we brought together all these key actors, state and non-state actors, and we kind of validated with them the findings and the figures of this costing exercise. Few lessons learned from this process. Well, we insisted that this consultation that I was referring, or in a participatory manner, to validate whatever the findings, the needs, the recommendation is extremely important, especially with the key actors that are involved in the community coordinated response at the local level, those key institutions. Political will is a requirement. It goes without saying. We had it at the beginning. We hope to have it until the end. So at least we can see that all these findings of this study will be materialized in financial and human resources terms at the local level. Involvement of the national gender machinery is also important because you have to respect also the national mechanisms and give the power and the ownership to the national mechanism. So we pretty much had on board throughout the time the Ministry of Labor, the responsible ministry, and also made the Ministry of Labor to lead the process of negotiation with line ministries for budgetary allocations. What we learned was also that although we had a well set and well-defined, well-developed policy framework, good laws, bylaws on domestic violence, not necessarily they lead to concrete result. Therefore, there is a concrete need to translate these actions into these laws and bylaws into the concrete action plans. Some recommendations that we actually handed or conveyed to the local authorities especially were with regards to the data collection. So we also took advantage of the set of harmonized indicators and which were approved also by the Minister of Labor, a set of harmonized indicators that put the points on or give us a greater picture of whatever the progress in delivering services at the local level has been made. So we reinforced the fact that local government units, local government institution has to collect routinely data and to report versus this set of harmonized indicators, including the indicators with regards to domestic violence or gender-based violence. Also, the alignment of this costing exercise with the current policies and at the national level, it's also important when it comes to the stage that you have to translate the national strategy into the local action plans. We found out that participatory budgeting processes at local level are good tools also to highlight the increasing demands of the public towards different phenomena, including also the domestic violence. And also it's a great way also to allocate adequate financial resources as per the needs and requests of the citizens. Also the capacity building of service providers, of these state actors and non-state actors in dealing with cases of domestic violence. We found out that the more capable and able they are to address the domestic violence cases, the less are the costs that are needed for this addressing of these cases. So yeah, basically that was it on the lessons learned and recommendations, and thank you for your attention.
Muchas gracias, Reza, por la excelente presentación. Quiero agradecer
to the timelines that we have now. We have the participation of Soledad Salvador. She is joining us from Uruguay, and she works in the Interdisciplinary Center for Studies in Uruguay, and she's going to give us a presentation regarding the costing of the differentiated impacts that will have the extension of the paternity and maternity. Good morning. I'm happy to participate in this activity, and I very much want to thank the invitation to share this costing exercise that after having done, I realized that it's, I found out later that this was the name that it had, the costing exercise, and that it could be an approximate figure to what up to now I knew as budget-sensitive budgets. I hadn't been working on that. I just know the experiences of the countries. Actually, I was invited to carry out this estimate because I'm an economist and a feminist, and I work with issues that are linked or it's a classic problem that I have talking very fast. Yes, and so by the same token, because I have links with social organizations from SIDUL, we work with syndicate with Pichiritec and the feminist movements, and also we work in the ministry, and they knew us, and I thought that I could dare to do this costing process. As the PowerPoint shows, the period in which this was developed was the 15th of October to 15th of December. I asked one additional month because 2 months was a pretty reduced form to what the work implied, which is not only estimate the cost of legislation, but also to gather the will of the main actors involved in this policy and those who could provide this policy, and to also build the argument as well as the revision of the international experience. So basically, it took me an additional month of work, and it's as an initiative the Ministry of the Ministry and Social Safety within a framework of cooperation from the UN People's Fund, which seeks the gender equality in the labor market. Since they have funds for that, they proposed that we do this study. Following the scheme that was proposed, the articulation that within the context from the year 2000, we had two legislative projects that were resting in the legislative committee. They were just written down and drafted, but they were waiting to be treated or addressed. We had different reasons, but had never been able to the possible discussion of a different commission. In both cases, what they were seeking out basically was, on the one hand, to extend licensed maternity leaves, and also the milking, the diminishment of working hours in the public and private sector. The Women's Association, the comparison of benefits that to be able to have the public sector. That basically deals with the issue that maternity in Uruguay today is 12 weeks for the private sector and 13 weeks for the public sector. There's a breastfeeding right, which is 2.5 hours, which is reduced by 1 hour, one less working hour, up to 6 months of age of the child. And in the public sector, the work time is diminished by half, and the paternity on basically very recently in 2010, they launched 3 consecutive days for paternity, while in the public sector they had 10 days, through which the differences were pretty notorious. By the same token, we had the agreement that of 14 weeks, which was reinforced this interest of not only taking but also the 14 weeks for maternity leave. In the year 2010, we had a team that today is in the Ministry of in the Work Ministry, but it's a new project that, since we had not obtained an agreement with the Ministry of Finance, which is the one that has to give the okay so that the project can move forward, we had stayed in suspense so that we could have an attention where basically what was proposed from the Ministry of Economy was to give away with the extension of rights and to give to an extension of mother leave and father leave. And strategically, you would say correctly, the other one is never going to come out, so we add to that proposal. And it would be a gradual thing. of the benefits would be extending it, and the next one. So the motivation to do this costing exercise in the year 2012, as was done, was that on the one hand you could exist a debate that would be interesting regarding building a national care system that would provide goods and services for the care that people that are more dependent, such as children from 0 to 12 years old, and the smaller population for which there is no sort of services, and the other which are more dependent. So in the other services, for the care in from 0 to 1, and that would give a framework to think about this licensing process. This first estimate, which was done in 2010, which this case was requested in a voluntary or honorary, I don't know how to say it, but without any pay. Perhaps you might be interested in participating in this exercise, and it was an interesting experience because I had never participated from the ministry in the elaboration of a legal project. I'd always been working from the outside. And the other motivation was the support which was given by the population, and it allowed us to expand and to develop not only strengths to how much it costs, but also this argument that was necessary so the different players would be able to see that their interests were being contemplated. On the one hand, the Ministry of Finance was seeing what kind of license this only promotes as a discrimination against women. They were very concerned that women would be discriminated and extend. And then afterwards, that there exists a clear insufficiency of labor in the Uruguayan because it's been growing in a dynamic way for 10 years, but the trained workforce is being restricted, and the participation of males has reached a ceiling in the activities, and unemployment is very low. It's less than 6%, and women evidently are the greater part of this figure. However, the inactive women in the debates that have been given in Uruguay regarding the national dialogue are called the work dialogue. The Ministry of Work Ministry, 200,000 women do not work because they have to take care of children at home. So that figure was talking about more women than the ones that are unemployed today. So this was another argument in behalf of and the progressive, to give it a name, to given nursing to a parental. Thank you. So to carry out this experience, this costing experience, this proposed in the first instance that is indispensable to the Ministry of Economy and Finance, by which we had to see interviews and to see what was the impression over projects, so we could see how to include within this evaluation the concerns that they had. And also, on the other hand, given the closeness of the feminist movement, to be able to put forth the imperative necessity to have interviews with the gender department from the PITNT, which is the syndicate headquarters, and the National Women's Institute, which had a position regarding projects, law projects. And by the same token, I found out that both of these tripartite that worked within the Ministry of Work had already elaborated a proposal in response to the ministry and a letter to the legal project that was being discussed from the year 2010, which the Ministry of Labor had not given to me, which was an interesting information to put on the table and to consider this an alternate scenario to put within the costing structure, and also from both parts to be able to recognize the need to be able to talk with some representative, entrepreneurial business representative. In this case, it was representative, which is a representative in what is the National Institute in Uruguay, which by the same token is also a businesswoman and represents in a great degree the smaller segments, micro, that are the ones that are always used to have the greatest difficulties to move forward this type of initiatives of licensing, because their personnel is clearly feminist. And by the same token, since they are small companies, to give some sort of benefits. It gives them less maneuvering room because they have less room to be able to make the replacements. So the result then, to be able to identify the concerns of these actors, to be able to include them in the report and to find answers that are incorporated into this type of proposal that existed, that was an ongoing concern, and to try to convince the labor ministry that they have to provide equal benefits between the public and private sector, but also go to the 14 weeks, so we could have a favorable willingness, both from the Female Institute, but also the Gender Syndicate, that did not provide support to the project of this maintained and only expanding for maternity to 13 weeks. This is the reason why the document was put forth, to put into dialogue these different visions. And only as an additional remark, the representation of clearly is referred from the licenses to promote the public sector can provide services, care services for these children. The argument was that the best that can happen to a woman is that they can have services so they can take their children. And there, the arguments from the public sector was not considered favorable institutionally. That is to institutionalize, to provide services, care services to children that are under 1 year of age, but to work what has to do with timely and stimulation. And by the same token, even though they were agreeing to do it and had a good positive attitude, if they had the going for the care and they didn't have the financial for 3 years old, and then go to the 2-year children, then go back to children 1 year old. So the possibility that the entrepreneurial proposal can be verified would take a long time. And that also helped to improve the arguments so that we have dialogue, so not everyone would have their own position. And regarding the description of the experiences, of the costing experience that you're most interested in, the methodology meant to have a simulation of 5 alternate scenarios based on the information that was available for 2010, of 2011 from the proposal from homes, and this was used as a source of information because the one that is available for everybody, because there's data there regarding work, regarding who has coverage, who doesn't have coverage, who has a salary, who's an entrepreneur or self-employed, and micro-entrepreneurs. And the project includes not only those that are salaried within the private sector, but also those ones that are included in social security, and also small companies, and only in large companies or large registered companies. So therefore, we have to identify that whole classification and also distinguish in their contributions to the social security, because, for example, there we have the professional social security, which does not cover this legal project. It's only covered by social security that is rendered by the state, and therefore we also had where to identify who were mother and fathers of children that were less than 1 year of age. And the Uruguayan and the 1,000 years that allowed to identify all the mothers and fathers. I say this because somebody here works with surveys. Not in all countries, in particular not in Uruguay, was it easy to be able to identify who were the parents of children that were not necessarily fathers out of the household. It's an estimation through that source of database. And the methodology consists in simulating a scenario of if there exists this legal project, if it had existed in 2011, how many people would have been benefited, how much benefit we've had in the social security to compensate if one understands the licensing for maternity leave from 2013, or if it's issued by people who never had this type of licensing, to simulate the scenario within the reality of that moment. And for the different alternatives that have been put forth, which were three initiatives. The first one linked to the project of 2010. There were 3 initial ones that were proposal of 2010. The 2 alternatives were discussed through the Ministry of Economy, when they said, if yes or yes, we have to include what would be the printing license, And we figured that by the year after 6 months of age, we would have 7 weeks. The job ministry would kind of point that they're not an intermediate point. And also the proposal of the Women's Institute of the Gender and Inequality, and proposal 4 and the proposal number 5, which was a new proposal that was elaborated by the Labor Ministry in order, as a legal project that was an alternative, given all that was presented before. We never had a linkage, linkage between planning and budgeting. Basically, this total summary gives us $20 million. Then this is a percentage that is not so relevant of the national budget. Basically, manage it as a percentage in relationship. The information, what we did really was a public presentation, calling of the press, and we certainly had process of the journals and many programs, general interest programs. They called for interviews to be able to talk about this issue and the importance of this being moved forward. And evidently, the social courtesy, we had to ratifying the 1993, which had not been had not been a 14-week license leave, and months of exchange with the economy. We were able to obtain very recently an agreement so that the legislation project can be approved with the ministries. Right now, it's at this stage with certain changes that were suggested by the Ministry of the Economy, Finance Ministry, but is significant regarding to what was expected. That is to say, they're including the father mother leave, and which is the risk that we had that this was not going to be included. And the challenges were to show the methodology where there was no precedent in this regard, and to be able to find how we could best simulate the reality along with the limitations of the information that was available, to be able to identify the company sizes, etc. To also be able to convince of the viability and the reality of these results. There were no obstacles, at least they were not perceived, and in order to overcome this, it was to maintain from the beginning the technicians from the Ministry of Labor. Since we had a previous estimate, the first thing that we did was to be able to talk with them and to ask them if, having seen how the methodology was used in 2010, if they had some suggestions, recommendations, or alternative proposals as to how to do it. And the answer was no, and since I was the one that knew how to do it, so therefore I could do it, or should do it the way I thought it should be done, and to maintain exchange with these technicians, so that I could tell them a little bit how the process was going for the elaboration of policies and promoting the policies, and to be internalized of the methodological that were taken, and they were approved. And so, as lessons learned, the positive impact of having interviewed these actors, because it allowed us to do a report that provided some answer to these concerns, and the possibility of generating alliances between actors, because when this was proposed initially, the Ministry of Labor said we have problems of relationing between the issues since the previous project, and we don't really have like a good dialogue, so therefore it'd be good for you to be able to contribute with this. And what was useful was to use an intuitive methodology, because it was easy to say and explain what had been undertaken. We didn't imply, as we sometimes know from other methodologies, econometrics or micro simulations, that sometimes it's difficult to understand what it is that is being done. So it's like an easy comprehension for non-specialized public in this concept. And the idea is to be able to continue making the effort to show that this policy, it's within the system, can contribute to the well-being. When we discuss the governance programs of the political parties that are being disputed, there is like a clear conviction of some of this formulation of programs, that this kind of programs are indispensable so that other development strategies can be enrouted, so that the bottlenecks that we live today with like we're going to be continued having, and the poverty circles will be continue being perpetuated. So it's like we began to talk a little bit more about this, and the conviction that the minister, every time he talked about it, he liked one phrase that had placed, something has to be done, because all of the players agreed that something had to change. The previous reality that for over 50 years the reality had changed in the labor market, so that one could consider it justifiable that something had to be done in order to be able to transform this. Thank you very much. Thank you, Soledad, for this excellent presentation. I think we have a very specific case. The government really wants to take a measure, such as the extension of hours of for both the fathers and the mothers, and we need to know how much that truly costs. And perhaps, Soledad, you can give us an idea of where we could finance these extension of the licenses. Well, now we would like to move forward to the last participant. Her name is Lina Nikanen, and she works in ONUCIDA. She joins us from Argentina, and she's going to give us a presentation regarding the costing of the commitments that we had in Argentina for the prevention of HIV and in general for addressing a plan in human rights. Well, good morning. No, I'm okay. Good morning to everyone. I'm going to make my presentation in English, but I would like to comment very quickly. I am not going to present a national experience in costing of human rights, but rather a tool that was elaborated in ONUCIDA in 2001, from 2011, 2012, through the costing of human rights within the context of HIV. And I would like to comment very quickly that the tool that I'm going to present exists also in Spanish and in French.
To present a national experience in costing human rights commitments in the context of HIV, but I will present a tool that UNAIDS has developed to cost human rights issues in the context of HIV, with some examples from various countries. And the tool that I'm going to present is available also in Spanish and in French. Okay, a little bit of background before I start talking about the tool, since most of you might not be aware of the HIV response globally or nationally. There are several commitments that countries have made in the context of the global HIV epidemic. Declaration of Commitment in 2001, Political Declaration in 2006, and another political declaration in 2011. And all these declarations include specific commitments on human rights and gender equality. And of course, all the other gender equality commitments and human rights obligations that countries have also apply in the context of the HIV response. This one. Okay. Just to give you a little bit of an idea of the commitments. These are from the most recent political declaration from 2001. There's 10 targets and elimination commitments that the countries have made. And one of them relates specifically to gender equality. Another one relates to stigma and discrimination in human rights. And one of them also relates to resources. This is from the text from the declaration, the commitment relating to gender equality. Countries commit to eliminate gender inequalities and gender-based violence in the context of HIV, and to take all necessary measures to create an enabling environment for the empowerment of women, and to strengthen their economic independence, and reiterate the importance of the role of men and boys in achieving gender equality. This is from another article from the same declaration, the commitment relating to human rights. And you can see in the text that the commitment relates not only to human rights outcomes, but also to the process to get there. So the countries have committed in this declaration to reducing stigma and discrimination in the context of HIV and protecting human rights, including through sensitization of the police and judges, training healthcare workers in non-discrimination, confidentiality and informed consent, supporting national human rights learning campaigns, legal literacy and legal services, as well as monitoring the impact of the legal environment on HIV prevention, treatment, care and support. So this is the basis for the tool, for the costing tool and other tools that we have developed in UNAIDS. Okay, a bit more on the background. To UNAIDS' role, of course, UNAIDS, if some of you are not aware, is the United Nations Joint Program on HIV/AIDS. So the UNAIDS is in fact composed of several different UN agencies, including UN Women, to work jointly to eradicate HIV/AIDS. And the mandate of UNAIDS is to support countries in fulfilling the commitments they have made in the context of HIV/AIDS. And the most recent, the current strategy of UNAIDS has a vision of 0 new HIV infections, 0 discrimination, and 0 AIDS-related deaths. So you can see that human rights in the strategy have been elevated to the same level with HIV prevention and treatment. It's a goal in itself. Okay, here's a little bit about the strategic directions. So there's 3 pillars: prevention, treatment, and then the third one is on advancing human rights and gender equality. So the strategic vision is to create a protective social and legal environment that enable access to HIV prevention, treatment, and care services. Have equal access for services to those who are most in need, and to address the needs and rights of women and girls in the context of HIV. Okay, still on the background. UNAIDS is advocating on the investment approach to HIV, and recently published an investment framework for HIV responses, which is based on a thorough analysis of what are the programs that work to reduce HIV infection, what are the programs that work to get people on treatment, etc. And this analysis showed very clearly that human rights and gender equality activities are critical enablers to HIV response. So unless countries in the context of their HIV response address gender-based barriers to prevention, or gender-based barriers to HIV treatment, or discrimination against people who live with HIV, or discrimination against those who are most vulnerable, they will never achieve the target of stopping new infections or keeping people who live with HIV alive. Okay. And the analysis that UNAIDS did on the investments, where the investments should go, show that these synergies and critical enablers are basically all the activities that are outside the mandate of ministries of health. Anything that's to do with capacitating people to protect themselves and reduce barriers in access to HIV services. So a lot of the resources that are invested in HIV should go not necessarily to ministries of health, but to other sectors of society for the responses to be effective. Well, let's go back to the human rights commitments that I mentioned at the beginning. Are countries fulfilling these commitments in the context of their national HIV responses? Well, Almost all countries report that they include human rights in their national strategic plans for HIV. I have included here the figure from 2010, but countries report every 2 years to UNAIDS on how they are achieving the HIV-related targets and how they are fulfilling their commitments. They also need to report on the human rights and gender-related aspects of their responses. However, UNAIDS did in 2009, and then there's been some later analysis as well, of national strategic plans for HIV across the globe in 56 countries, and also in major funding proposals to the Global Fund to fight AIDS, tuberculosis, and malaria. And this assessment showed that although almost all countries mention human rights and gender equality as guiding principles or cross-cutting strategies, the strategic plans generally include very few concrete activities. Well, some are included, but most of these drop off in budgets and in M&E frameworks. So there might be some activities included, but if you don't have the budget, or if you don't include any indicators, it's unlikely that those activities are actually being implemented. So, to support countries to fulfill their commitments, UNAIDS has done a few things. We've started developing some tools and guidelines that help better integrate human rights and gender issues in the national strategic plans and in the national HIV responses. I'm not going to talk about the development of indicators or very much about the definition of key programs, since this is focused on costing, but I just want to emphasize that the definition of indicators is very important in all of these, also in the context of these costing exercises. Because if we don't have indicators identified for gender equality targets, or if we don't have concrete indicators against which we are measuring our progress towards the gender equality targets, it's very unlikely that we'll get concrete about the activities and the costs and the resources needed to achieve those targets. Okay, I'll just very quickly mention where we didn't start with the costing tool. We started with trying to define more clearly what it means to address human rights issues in the context of HIV. We realized that since countries say that they're in their national strategic plans that human rights are cross-cutting and their guiding principles, we realize that it's not necessarily about the lack of political will, but it's the lack of capacity to really understand what it takes to address human rights issues or gender issues in the context of the HIV epidemic. So with the help of a human rights and HIV reference group that is composed of independent experts in the field, UNAIDS identified these 7 key programs to reduce stigma and discrimination and to increase access to justice in the context of HIV. And these programs are programs to reduce HIV-related stigma, HIV-related legal services, programs to reform and monitor laws relating to HIV, or any legislation that has impact on the HIV response, either enables or hinders the HIV response. Legal literacy programs, for example, Know Your Rights campaigns. Human rights training for healthcare workers on issues of non-stigma, discrimination, confidentiality, informed consent, etc. Training and sensitization of law enforcement agents on HIV and human rights, especially in countries where HIV epidemic is concentrated among populations whose behaviors are criminalized, for example, men who have sex with men, or people who use drugs. And finally, the programs to promote the rights of women in the context of HIV. You see that one of these is specifically related to gender equality and women's rights, but in fact, all of these programs can be used in women as the target population, or to advance gender equality targets. And as you can see, as I mentioned at the beginning, a lot of these go beyond the mandate of ministries of health, and also highlights the issue that has been mentioned here before, the importance of involving civil society in all of these costing exercises. Because often the civil society organizations are in fact the implementers of the activities. Okay, let's move on to the costing part. So there's many challenges in costing HIV-related human rights, and it of course applies to all gender equality issues as well. We heard from many national partners and internationally as well that yes, we would like to include human rights in our national plans and do something about stigma and discrimination, but we are not quite sure what to do. And the costing expert said, well, unless you really define what are these programs, what are these activities, we can't cost it. We can't cost an abstract idea. We need to know what are the exact activities, who do you need to implement them, etc. There's a very little literature and data on the cost of HIV-related human rights programs. Excuse me. For example, it's easy to estimate the cost of antiretroviral treatment, or the number of HIV test kits, but it's not so easy to estimate stigma reduction, for example. And another challenge is that when we talk about human rights or gender equality as cross-cutting, or that they need to be mainstreamed, versus standalone activities. And of course, all HIV programs or all other sector programs should be implemented through a gender-based approach and human rights-based approach. But that also needs to be costed. It needs to be identified what it is that needs to be mainstream. What are the specific activities? What are the specific resources needed for that mainstreaming to actually to take place? And the difficulty of making estimations when knowing your rights affects demand. What my colleague mentioned here on the increase of reporting of domestic violence cases in Albania, it's probably not because there's more domestic violence, but it's probably because the women are more aware of their rights, they are more have more confidence to go and report the cases, etc. So once you increase the awareness of people's rights, once you increase the awareness of the systems that are in place to claim their rights or get some response, the cases are going to increase, which makes it more difficult to estimate the demand. Okay. So, on the basis of these 7 key programs, UNAIDS developed this costing tool. And the objectives of the tool are to conduct detailed activity-based costing of human rights at the provider level. The problem we saw when trying to include the cost of human rights-related activities or gender-related activities in national plans was the lack of unit cost. We didn't know what was that dollar amount, or what was that peso amount, or the bolivar amount that would need to be integrated into the as an input into other costing tools. There are a lot of costing tools that are used in the context of HIV. Some of them include human rights as a specific category, but unless you have the input that goes into that category, you cannot calculate the cost. So this tool responds to that gap in the cost data. So it allows to estimate average unit cost and then also estimate resources needed to operationalize human rights commitments. Just very quickly where the tool fits in the sort of the bigger planning landscape. The tool cannot be used to identify needs or identify priorities. That needs to be done separately. The tool it's only used in the part when the estimation of the needs and the priority setting has already been done. However, I want to make a point when we have been using the tool in various countries. We have seen that, in fact, it's useful to use the tool when countries are doing an assessment of the current state of the HIV epidemic and the current state of the HIV response. And why is that? Often when countries do these sort of assessments and then start the planning, they don't assess what is already being done on HIV-related human rights or what is being done on gender-related issues in the HIV response. The costing tool helps countries identify what is already being spent, what activities are already being implemented, and that can help then in the planning process. Okay, then looking at it from the costing perspective, as I mentioned, there's really a lack of data on the unit cost. So the tool is mainly to be used at the provider level. So basically the methodology is that you go to each organization that is implementing human rights related activities, both state institutions and civil society institutions, in some cases also private sector companies that might have specific programs on, for example, reducing HIV-related discrimination. And you apply the tool in those organizations. I'll get to the details of it. Okay, these are some of the basic characteristics of the tool. It's Excel-based. It comes with a guidance document. For anyone who knows how to use Excel and has even a basic understanding of costing, it's pretty easy to use. I probably wouldn't be able to use it myself. I'm not a costing expert, but that's what I've been told by my colleagues who are costing experts. It's built over the 7 key programs recommended by UNAIDS that I mentioned. It's flexible and adaptable. I will show you in a bit. It comes with a basic basket of programs, but it can be adapted. Different activities can be included, so it can be used in many different contexts. It is designed to be used at the provider level, and it can be used by program officers, financial officers when developing plans or project proposals, etc. And it's a complementary to existing costing tools. As I mentioned, the inputs from the data from this tool can be used as inputs in other costing tools at the national level. I'll go through these very quickly. These are just the different steps or the different data that is useful during the costing analysis. The first step is to define the programs and activities. Second step is to identify outputs. You input the cost of human resources that are directly associated to implementing the program, and the guidance document also advises what to do when a staff members, for example, dedicated one part of their job to that project, and when they're dedicating part of their time, for example, to HIV prevention, that's not directly human rights or gender related. Reporting on indirect cost of the organization. And this is a very important part of the cost because it has actually allows us to calculate the real cost. Often we only include the cost, the direct cost of human rights related activities. And finally, reporting the specific operational cost directly associated with the activity. This is just to show you a little bit how the tool is structured. So it has. This is just examples of the two of the 7 key programs, and you cannot in the tool you cannot change those 7 key areas, but they are pretty broad. So it's adaptable because the activities that are included in each category can be amended, or you can add others, etc. So, for example, for HIV-related legal services, we have separated the different types of activities from each other. Provision of legal information and referral can be done by paralegals, people who don't have legal training. Legal advice or legal representation is something that is done by lawyers. Mediation between local service providers, strategic litigation, alternative forms of dispute resolution, research and analysis, etc. So it's, each program has a sort of basket of basic services. The uses of the tool. The data that is generated by the tool can be used to estimate the funds required for operational planning or budget proposals. It can inform the development of national strategic plans for HIV. It can support the evaluation and monitoring of those 7 key programs. And the data can also be used to evaluate the HIV response in terms of cost effectiveness or cost efficiency. And as I mentioned, it can be used to provide input into other costing tools, and the data can be used to support advocacy on including these programs in national HIV responses. The tool was piloted in 14 countries in 2001, and it is currently being applied in Jamaica. They have finalized the exercise, and the cost of the 7 key programs were included in the new national strategic plan on HIV. Indonesia is just about to finish the process. Mozambique is also applying the tool, and in Argentina we're applying the tool. And in fact, I forgot to put here that Honduras is also about to start using the tool in the context of their national strategic planning for HIV. Some of the lessons learned in the countries where we are currently applying the tool is that it has been really helpful in identifying the real costs, including the indirect cost of the programs. And although the tool it's a planning tool and meant to be used to support the planning, the process has in fact helped to generate broader discussion about what it takes to address human rights in the context of HIV. And since it includes these 7 key programs, it has allowed people to see human rights in the context of HIV in a more concrete way. That is something, there are practical things that can be done. It has also allowed to place the costing at the center of planning or defining the content of the programs, and not something that is done in the end, if done. And it has strengthened the capacity of civil society in strategic planning and resource mobilization. Because in all countries where it has been applied, the tool has been applied in civil society organizations and in state organizations. Then some of the challenges. The fact that it includes these 7 key programs that cannot be changed has, in some cases, been challenging because they are very overlapping. Some of especially the one related to rights of women, many of the activities in that particular category are also repeated in some of the other programs. So sometimes it's challenging to see where you put which activities. We have also seen that we need to better define the activities that are listed. UNAIDS is currently doing a better definition of all the activities because at the moment they might be defined in different ways, and then therefore we can't compare the cost across organizations or across countries. Another challenge is that to identify or calculate the unit cost, the tool needs to be applied in a large number of organizations that are implementing these activities. And in many countries, these activities are only being implemented by a few civil society organizations. What we are hoping in UNAIDS, we are hoping to collect data from several countries to be able to do also a global analysis that can be fed into resource needs estimations for HIV response that UNAIDS takes on, or for the Global Fund to fight AIDS, tuberculosis, and malaria. 2 final points. It's difficult to engage partners beyond the National AIDS Program and the civil society that are working directly on HIV, but as we all know, all of these issues that are cross-cutting, whether it's HIV, gender equality, or human rights, need to be addressed through different sectors if we are going to have an effective response. And the final thing, when we've identified the cost, whose budget is it going to go into? And it's the same problem with the sectoral approach. Ministers of health say, well, this is not our responsibility, it's not part of our mandate, but other sectors don't necessarily have the political will or commitment to engage in it. And of course, since many of the programs are type of programs that have to be implemented by civil society organizations, we also need to think about whether activities by civil society organization can be included in a national multi-sectorial plans. That's it. Thanks.
Muchas gracias, Lina, por la presentación de esta herramienta.
To share it with everyone. Okay, and then we have, according to this time, we have 15 minutes for the question and answer session. I would ask for you to be to the point in the questions that you make. If we'll make 3 questions, question and answers, and then we make another 3 questions. Any volunteers? Here we have one.
The tools or the presents are very practical in a practical manner, so we have grasped a lot. I have just 2 questions for the first presenter and for the second presenter. From the presentations, it's clear that getting the right information is an issue. So with the first presenter, from Rwanda, to get gender disaggregated data using or engendering the M&E tools was recommended. So my question for clarification is, have you done this, or is it practiced considering the challenge at local level to really get information? Have you engendered the M&E tools, and have you practiced, or it's not yet done? Maybe for the second presenter, it's a related question. You have recommended that reliable data is needed, especially in a case where domestic violence is very sensitive, especially in developing countries where it's a patriarchal society. So how can we get that data? Yes, it's needed, but maybe if you can just give us more idea on the how. Thank you.
Bueno, también
Were very interesting. I have two questions for our colleague from Rwanda along the same lines. If you can give us more in-depth information regarding the methodology that was carried out in the costing out exercise, and also the information that was used. And the second question would be for our colleague from Rwanda: how do you articulate the costing excesses with the budget? Because on the one hand, you have these strategies, the PSTA, which are strategies, they're operational strategies from the agricultural aspect, but I don't have clear whether these strategies are part of the public budget. So how do we articulate the costing with the public budget? And for Lina, very briefly, to see if this application in pilot programs, there's a above and beyond of the guidelines that are being used, if there's information regarding the application of these pilot programs from which we've applied, or from the website. Thank you very much. Also, I would like to congratulate all of the panelists. Really, the experiences that you're sharing with us are extremely valuable to all of those of us who are involved in this kind of work. The question to the point is for Lina, regarding the use of the tool that has been presented to us. Lina mentioned that at this time, the tool is being applied in Jamaica, Indonesia, Mozambique, etc. And I would like to know which is the organ or the organism or a ministry or whatever, what institution is the one that is the operational counterpart for this type of work, because depending on that, I would guess that the focus is different. Thank you. I don't know if we begin, perhaps Caritas can...
Very much. I think the first question was to know if actually we have engendered our monitoring and evaluation tool, view the challenges that countries are facing in regard with the gender disaggregated data. My answer to that question is yes, partly because we have already engendered the M&E framework for the strategy. And once you've made that, the rest is just to make sure that the existing tools, namely those forms that are sent in district, mainly for our case, because that district in Rwanda is the solely implementing agency at the grassroots level. Once you make sure that reports from district are gender sensitive and gender disaggregated, then our main challenge today is to make sure that all the forms that we are using to collect those data facilitates the users to make sure that gender disaggregated data are I made specifically and clearly and spontaneously from the grassroots level. The second question was actually I got it in French because I was getting the French translation. Elle demandait comment. Donc il m'a demandé d'approfondir l'outil et la méthodologie que j'ai présentée à propos spécifiquement du coût, du budget vis-à-vis notre PSTE, notre plan de transformation de l'agriculture. Et
desarrollo de la agricultura y especificar si se trataba de un presupuesto público o no. Diciéndole que
by saying the following. Currently,
no he aprofundizado
we
como
have
dice,
not go in depth as you have
Pero en Ruanda,
mentioned, but in Rwanda,
existe una
there
agencia
exists an agency
llamada
called,
les achats publics, Autorité pour les achats publics.
es un nombre que no entendí en francés, perdón.
Y esta
Y this institution
dispone de documentos
has
para
base
todas las
documents
personas
for all people
que van a
that
hacer ejercicios de
go and make budgeting
para
exercises
planificación,
for action plans.
van a presupuestar.
They're going to
Y allí
being
podemos
able to make a
encontrar
budget, and here we'll find
diferentes
differences
precios de las
prices
intervenciones.
of the interventions, for example, the costing of hotels, of transportation.
Todos esos
All of
datos
these
están
data are
especificados
specified in the
documento de esta
document
institución.
of this institution.
Además,
And besides,
cuanto al
regarding
presupuesto,
as far as budgeting is concerned,
lo que yo he tratado
what I have
de
tried
subrayar
to
acá
underline here was
que lo que nosotros
that
hemos
that which we had
presupuestado
budgeted
en relación a
in
la
relationship to
integración
the
del tema de
integration
género,
of gender
no son más que
is not
trabajos
only work,
preliminares,
the preliminary work,
para
to be
ayudar
able
a
to
que
assist
todo entienda
so that everyone can
la
understand
dimensión de
the
género
dimension
en
of gender
agricultura.
in agriculture.
Las demás
The
intervenciones
other
las hemos
interventions we have
adaptado
carried out
para
in order
hacer
to
de manera que nuestro plan
make it in
de
such a way
plano
so
de
that our
transformación de la agricultura,
planning for agriculture,
el plano
the
estratégico del
strategic
ministerio
plan
en
of
sí
the
mismo,
ministry per se,
sea
can be not
sea
can
responda
be
a la
answer
dimensión
to
de género.
the gender dimension,
Es una
and this is a decision
que se debe ver a
that has to be seen in the long term.
en nuestro caso,
In our case, specifically, we saw that it was not necessary
disponer de
to be able to dispose of 2 or 3 documents,
pero lo que
but what we did need was to be able to have a document, the main document, which was the strategic plan for the transformation of agriculture,
fuera
was
estuviera
and would be
capaz
able
fuera capaz de ayudarnos
to assist in the reduction of gaps amongst the sexes in the agricultural sector. And we insist in underlining that the answer that emanates from the sectorial strategy,
más que
more than from
colocar aparte
being able to put that strategy as something on the side in the integration of gender. I don't know if that satisfies the answer to the question. Thank you. We go to Lina. I don't know if I'll answer in Spanish or English. Bueno, voy a contestar.
So information from the pilot countries. We haven't systematized or published the information. We have all the data that we have collected. the problem with the piloting exercise was that the tool was only applied in 2 organizations per country, or in some cases 3. So the amount of data that we collected in the pilot exercise was not really sufficient to make any global analysis. It was mainly to validate the tool. But what we are doing now, when the tool is being applied in a more in a larger scale in countries, that we are documenting that experience. We'll put together a sort of methodological note on the whole process. The guidance document that comes with the tool only gives you guidance on how to apply the tool at the provider level, but it doesn't give you guidance on the broader process. How would you set up the process? Which partners to include, etc. And when we have been applying the tool, we have seen that it's very important to have this broader discussion, because often, although we thought that the tool would come in the end of the planning process to cost the programs, we've seen that in fact it's introducing the tool helps you in fact start the discussion. So we will produce something that will document this sort of broader process or the methodology. The counterpart, it depends on the country, because depending on the level of the HIV epidemic, some countries have multi-sectorial commissions that in some countries in Africa, for example, might be headed by the president or prime minister and include representation from various ministries. So in those countries, the counterpart would be that multi-sectorial commission. In other countries, it's a Ministry of Health, or more specifically, the National AIDS Program, with the involvement of other sectors as far as possible, and civil society organizations.
Of data to build an analysis or costing exercise, I think that in Albania we got a little bit lucky because of the measures that were implemented in due time. So there was a national survey on domestic violence of 2009, and we are preparing for the second national survey this year. Also, there was this set of harmonized indicators on gender equality, which defined some indicators and set of data that should be collected by different state institutions with regards to government commitments toward gender equality in different sectors, so including prevention of domestic violence. And also we had bylaws following the law on measures against violence in family relations. The bylaws had defined clearly of all these key actors involved in this community coordinated response to domestic violence to collect and to record every single domestic case that comes to their office, to their doors. So this coordination between institutions, so it is created also a network of data exchange, very discrete between the specific users within these institutions. So I guess this also helps. So for cases reported to the state police, we go to the state police and they have the current data, updated data. Also, we consulted the annual statistical reports. Each line ministry provides on annual basis statistical reports based on administrative data. So they have their administrative services, they collect the data, and they report the data in these annual reports. Also, I try to put emphasis on, when I was presenting the case, we have to rely, as UN agencies, have to rely on official data. But also we have to consider the non-official data. So that's why I put stress on consultative processes between when we have the findings or preliminary analysis between, we know that there is discrepancy between state and civil society or NGO service providers. That's why it's crucial to have these consultative meetings so we can validate, cross-check the data and come up with an average results and well understood and well mutual, let's say, result of this study.
Gracias, Reza. Estamos
Time. I don't know if anybody else has a question, or you would just rather approach the presenters during lunch. Two. Very quickly and to the point. And Soledad, she stole me the question. Okay, this is for our colleague from Rwanda. If you could perhaps go more into depth and to explain a little more what the interventions were about regarding the family in the agricultural sector. And what is still not clear to me from our colleague from Albania, if they were able to determine to the exercise, they were able to determine which is the cost to the state, to the government, in regards to the issues of protection, such as he mentioned. Thank you. Good afternoon. My specific question to the presenter from Uruguay, Soledad, within the framework of being able to the sustainability of the project, of what is being developed, how have you determined the opportunity cost of this? We understand that our governments are the ones that are responsible for the development of our policies and not of the policies of the programs that we're undertaking. However, the tendency is that we're going to have the political will, and if and when it's viable, that is, it's above a break-even point. How did we determine the opportunity cost, and if you have the opportunity cost in the case of Uruguay, precisely to be able to maintain the sustainability? Regarding the first question that you were asking me regarding where the financing would come from for the project, clearly, as always, budgets are tight, and in each rendition in Uruguay, we have the national budget. Every new government and every year there's a big coalition of the budgets of what was spent and to see what is available and what is considered financially the debts, the loans, and there's by the same token foreign pressure as the country that has financial stability. We have been able to seek to have in-house resources for the social security benefits until the end, because they don't want to live a crisis during this government. So there were kind of like a lot of conditioning factors that had to be gathered, but basically it comes from general income, from social security, that has important, it's a contributing social security system, but it's 7 points out of the 22 points of the IVA go towards ensuring retirement. So it's contributing. It still leaves much to be desired, because much is financed through the general income, which is held through income. But by the same token, in Uruguay, we have, as of 2007, the the income tax to people that have been adapting, that there is also there's like a play of market value that also don't consider that the cost is very high, but that obviously, since this is the resources, once the legislation moves forward, then the resources are going to have to be put forward on a year-to-year basis. And what is today is a conflict in the rest of the ministries It's at that margin when you make a rendition of expenses and budgets, which is the example that manages the resources for social policies, has to evidently has part of that the availability for its own policies, and by the other hand, they also have a correlation of interested powers that be regarding what has to do with the issue of education. There's a mobilization that is very strong regarding the whole period of government of what is the leftist movement from the year 2005, both from the health sectors as well as the education, in order to be able to attain greater salaries, which are fair, but effectively they have been giving themselves raises that are insufficient. And so there's that whole conflict, internal dispute, but as the finance ministry said, the resources are going to be available and the financing will come from what I mentioned, general income taxes, and is financed in this way with indirect taxes such as the value-added tax, etc., that exist today, and a little bit more. And the question was the opportunity cost. It's very interesting, the question. What exists is information regarding the cost that these women that could come into the labor market could contribute to Social Security, and in that report we didn't cost out which would be like the benefits, evidently, both for the women that today are not in the labor force, as like those that are informal because they don't think that they get a benefit in if they're doing self-employed, or it's a new regime that is being implemented where you're a sole contributor, to be able to make a sole contributor, but that they don't do today because they don't think they don't get any benefit, and that this project, that the project that's going to give it is, yes, this is going to contribute to formalize a labor force, for women labor force that today are informal, and this would help the financing of the project itself, but that would be it.
Try to be brief, but allow me to also to respond in French.
Question was,
Me pedían que
they were asking me
profundizara
to go in depth
sobre cómo
regarding how we were able to have the interventions in the agricultural sector could be take into consideration the gender element. And in response to that, I would say, because the question, they would say that the agricultural sector would intervene, and what is the position of the Rwanda family?
And what inside the agriculture sector? I'd like to enlighten that in consequence of the genocide I've already mentioned, by which more than 30%
of the population and the women, of women work, dedicate themselves to agriculture. Over 52% of the population of Rwanda are women. And thus, as a consequence, it is convenient for us. It's important for us to be able to have women to feel satisfied by their agricultural activities, because they represent the largest part of the agricultural labor segment. And the agreement has to be visible. This, and thus thinking, not only because it's about women, but also because they are the majority of hand labor in agriculture. So what do we do then so that these women can feel satisfied and can be productive as a consequence? They have to feel satisfied of the interventions that have been developed by the ministry in favor of the population. How do we address this? For example, we make an effort so that women
sean satisfechas de los servicios.
of the services.
Por ejemplo,
For example, the provision of fertilizers, for example, which are distributed, that are made available, such as interventions, programs that we have, que se llama, that is called One Cow Per Family program. And the objective of that program is to eradicate malnutrition and giving one cow per family or a poor household to be able to ensure that women can have enough milk to be able to balance out their nutrition, their daily nutritional needs. And also under that program, we would have to suppose that women can benefit themselves by the same token, just like men. And I can assure you that at this moment, 70% of women benefit themselves, can benefit from this program, because since they are the poorest ones within our population, thus they have to be the greater benefits than the men. And also, in what concerns the information in agriculture, when one asks oneself, when we call for a meeting, or there is a training program, we request the family the heads of household. When we talk about heads of household, the men always show up, who come to receive training. And they receive the training, and the knowledge that is shared never gets transmitted by the man to the woman. But it's the woman, the one who is in the day-to-day agricultural activities. So the strategy of integration of gender in agriculture was that we would first saw that there were parameters that we could not ignore. For example, we call the training program. First, we have to make sure that the women are the ones that are going to be represented, because we knew, we know, that women have a lot to say in the agricultural field. That is to say, they have more inside information, they are more involved in the day-to-day life than the men, and thus we know that this is how we apply these measures. Gracias, Caritas. It's okay. Para responder la pregunta.
Local government units that we piloted the costing exercise, and it goes the same for the alike government units, the ones with have alike demographic trends and domestic violence reporting trends. We were able to calculate and to define that it will cost basically for a case of domestic violence, a local government unit about $450 per case, which includes also direct cost, administrative cost, but includes also the costs of the survivors of the domestic violence. But this year we conducted another study, which we were able to disclose to the government, to the central government, the cost in addressing domestic violence. As you may know, Albania signed the Council of Europe Convention on Prevention of Domestic Violence. And since we signed, UN Women and the government of Albania worked to define some costs related to the Albanian government to comply with this convention. And basically, it will cost for the next 5 years to the Albanian government $1 million per year. And only if the Albanian government would commit $1 million per year in the next 5 years, the Albanian government will be able to save 5 times as much as in the next 5 years. So the commitment is crucial because you save in time, you save in the long run.
Muchas gracias, Retsa. Bueno, pues con estas intervenciones
presentations. And with this, we would conclude this session number 5. We're going to go to lunch, not without saying to make a brief summary, and also to invite, now that we have many more elements regarding the different methodologies and approximations to the exercises, the costing exercises, that we can once again take a look at the document that is in our carpeting folders and files. Now we have many more archives that give us the differences that they exist between one methodology and another. And it's also important to be able to say, and we have seen it with these 3 interventions, that there's always certain elements, certain common elements, that is to have a planning strategy, to have an equality policy, the alliance with strategic players, that is to say, certain steps that we cannot overlook previous to costing access. Thank you very much, and I don't know if we give a warm hand of applause to all of our participants. Thank you very much. Time for lunch has come. The lunch will be at the restaurant La Terraza, and for the return at the first hour in the afternoon. The word this afternoon will be tables. So there's certain people have not registered, and we would like to for you to finish your registry in the seminar in order to determine in what work tables you're going to have. We have 5 moderators for the tables for this afternoon, 4, and we're going to organize the working groups in the first hour of the afternoon. So first step is, for those of you who have not registered, please go ahead and do so.